So I want to welcome everybody. Those who are on already, welcome you to the program. We have selected a unique topic for today on prostate health and heart health. So we can imagine today somebody is going to give us a talk on how we can handle it, how we can prevent it, how we can handle such problems. Also, Professor Ofambe is very, very versatile in this area.
All right. Good evening, everyone.
Good evening, Prof.
I am pleased to be here this evening to share some thoughts about the indications. And I've been given the title role of a therapeutic nutrition in a prostate and heart health. First of all, let's just consider what is a prostate. It is important to know this. A few minutes ago, I was talking to someone and happens to be a female, and she does not know the difference and thought that as a female, maybe she has a prostate, but that is not correct. It is with men. Prostate is a gland that produces some of the fluid that carries sperm during ejaculation. And it surrounds the urethra, the tube through which a urine passes out of the body. And when you look at the prostate gland in terms of a size, it is not a very large, but about the size of a walnut. But on account of its location in the body, it may cause some problem if something goes wrong. It is positioned beneath the bladder and in front of the rectum, and the prostate gland also encompasses the upper part of the urethra and that duct that transports urine away from the body. So some problems with the prostate might affect the urination and might also cause a sexual dysfunction and can cause many diseases and issues with men. Now, you have these structures put here. We can see the size of a normal prostate. We can see the bladder, and we can see the urethra, and we can see the prostate gland surrounding that. And that is one that is a normal. But in a situation where there is an inflammation, either a man has encountered diseases like venereal diseases, syphilis or gonorrhea or whatever, there can be what is called inflammation, and that is a swelling of the prostate. And it's something that is usually common. And you can see it impinges upon the urethra, and that can bring about an issue with urinary flow. We have another condition that is called a BPH, that is enlarged prostate. In science or in pathology, we call that a benign prostate hyperplasia, BPH. And you can see completely it has impinged seriously upon the urethra, and gradually, if it's so serious and severe, a man may not be able to pass a urine, and that can bring about retention and can cause a bladder problem. And by virtue of ascending infection, it can also damage the kidneys. So benign prostate hyperplasia is common in men, ranging from 40 to 50, especially the elderly in the 60s and 70s and above. If care is not taken, it can progress into what is called a prostate cancer. We have the histology of the normal prostate. You can see how it is. And the prostate cancer, you can see it here. So now let's consider enlarge the prostate. That is a BPH. It means the gland has grown bigger, and enlargement happens to almost all men as they get older. An enlarged prostate is a condition that most commonly affects men over 45, as I said, but nowadays we are seeing it can begin even from the age 30. This condition is called a benign prostate hyperplasia, as I've said. It is benign and it is not cancerous, but can sometimes have similar symptoms to prostate cancer, especially when it progresses. Now, if not treated on time, as I said, it can bring about blockage of a urine and also can cause a kidney damage and a kidney infection. Now, we have some symptoms of a prostate infection. You can see intermittent flow of blood, difficulty controlling the urine flow, inability to urinate at serious, frequent urination, frequent visits to bathroom, especially at night, a very weak flow of urine, pain or burning sensation when urinating, problems achieving or maintaining erection. It can also affect a sexual relationship. And sometimes, if it's severe, you can have the presence of blood in the urine or semen. And at a very serious state, it can bring about pain. That is a lower back pain and etc. So what are the causes? The cause actually is unknown, not really known, but several issues have been implicated in the etiology of a benign prostate hyperplasia. One is heredity. If your father or grandfather has BPH, you are likely going to develop it. Lifestyle factors, being significantly overweight, that is obesity, it can cause that. Lack of exercise, maintaining a sedentary lifestyle, that can also cause it. Hormonal imbalance is another factor, and age is also another issue. The risk of developing BPH increases with age. More than 50% of all men have and by the time they reach 85, this figure rises to just under 90%. Other thing is medication, prescription medications such as diuretics, antidepressants that can aggravate BPH symptoms, and also some other drugs used to treat allergy and common colds have been in the etiology of a BPH. Medical conditions such as diabetes mellitus, heart diseases, cardiovascular disorder, also they raise the risk of developing BPH. Now, what are the steps to determine the extent of the problem? One, relevant tests are recommended, tests like a prostate ultrasound, urine examination, blood test, and specifically serum prostate-specific antigens. It is usually recommended that a man, especially at the age of 50, should carry out this test. Every man to do this PSA test regular, at least once in 6 months or once a year. Now, what do we then know about prostate cancer? Prostate cancer is different from BPH. If it is not taken care of, that is BPH, it can lead to prostate cancer. And it is the commonest male cancer. The estimated lifetime risk of disease is about 17.6% for whites and 20.6% for African Americans. The lifetime risk of death is 2.8% and 4.7% for blacks. So you have that. These are some of the things we know about prostate cancer. The incidence rates in Asia is about 1.9 cases. The mortality in Sweden is 23 per 100,000. So you have the risk factors for prostate cancer, familial prostate cancer, genetic influences, the presence of a testis, and also died. Now, when you have the symptoms, you have asymptomatic symptoms, asymptomatic cases, and you also have some of the symptoms that can be displayed. Local symptom storage, that is voiding, as I've said. Symptoms of complication, urine retention, hematuria, that is blood in the urine, incontinence, etc. Now, for the prostate cancer and the BPH, here's what I can call the summary and take-home message. 1, prostate infection is common in young men. BPH affects 1/3 of men in Nigeria, that is 1 in 3. Prostate cancer is the commonest cancer of men. Genetics plays an important role. There are also modifiable risk factors. Early presentation of a prostate cancer is curable. That is, if a person takes care of it early enough. Delayed presentation, only supportive treatment can be adopted. The burden of BPH and prostate cancer are enormous and requires a support and understanding of family members. Now, I will go back to some of the therapeutic approaches to that, but let's check a few things about the heart. That is the second part of this lecture. It is the strongest muscle in the human body. It's the size of a fish, relatively small, and there is no heart, there is no life. The heart beats starts at 21 to 28 days of a gestation. That is even before someone is born. It beats an average of 70 times a minute, 100 times a day, and 2.5 billion times in 70 years. It pumps about 3,000 gallons, 12 liters of blood throughout the body daily. These are some of the functions of the heart. Now, diseases that affect the heart, congenital heart disease, it is the commonest. You also have heart muscle disease, and don't let me go too technical because of the audience. We have a cardiomyopathy, hypertrophic cardiomyopathy, etc. Now, rheumatoid heart disease, this one is really no longer rampant or common. Now, cardiovascular disease, we call it a silent killer, and that is when silence is not golden. The disease affects major organs in the body, but the cardiovascular diseases are the worst and claim a life silently. Cardiovascular disease, they are referred to as silent killers, and death is often sudden. That is why you see somebody who sits down and everything is okay. Within a couple of minutes, the person slumps. Somebody is dancing and everything is okay. Before you know what is happening, the person slumps, and that is the end. Somebody might even decide to sleep and the person dies in his or her sleep. So these are why is the reason why it is referred to as a silent killer. Now, cardiovascular disease, cardio means heart and vascular means vessels, arteries, and the veins. It's the commonest non-communicable disease all over the world, and there is a shift in the prevalence from industrialized nations to African and developing countries now, which creates a double burden for developing countries. Now, in Nigeria, average of 300 people die daily as a result of cardiovascular diseases. Young people at their prime ages come down with a stroke, heart attack, and a kidney failure. This is also as a result of our westernized lifestyle changes. The prevalence of cardiovascular disease has increased in Nigeria, thereby doubling the burden of our ailing economy. What do I mean by westernized lifestyle changes? Now, Nigerians now want to be like the Americans, and the kind of a diet that they take, the burger, and all sorts of things. We have left our normal, customary diets, and many times now, we are taking the westernized diets, and that has brought about, increase in the surge of cardiovascular diseases in our country. Now, what are the cardiovascular diseases? Major ones are hypertension. Diabetes mellitus is closely linked to it. coronary heart disease, stroke, that is a brain attack, and also kidney diseases. Hypertension, we all know about, is common. That is when the blood pressure is a greater or equal to 140/90 or 2 or more times. And the etiology is also not known, but some of the risk factors have been highlighted. Asymptomatic, it may not actually bring about some symptoms, and that is why it's called a silent killer. Now, diabetes mellitus, as I said, has a close link and exists with a cardiovascular disorder. Now, you have atherosclerosis. You can see that the artery walls, and when there is an increase in a plaque, it can block the flow of the blood and can bring about some complications. Here you see the plaque occlusion, you have a hemorrhage, you have a blood clots, and that can also bring about what we are talking about. Now, stroke is another thing, that is a brain attack. It occurs as a result of disease to the vessel that supply the brain, and it can be hemorrhagic or it can be ischemic. Hemorrhagic, that is when there is a bleeding into the brain, and ischemic, that is a blockage of flow of blood to brain. And the latter one, has a better outcome than the other one. It is usually common in elderly, but can also occur in young ones. So healthy lifestyle, cost of management is enormous. Prevention is better than cure. More than 80% of death from heart attack and stroke can be prevented by healthy lifestyle or early presentation for health. This can be achieved by preventing cardiovascular risk factors. The risk factors, non-modifiable and modifiable. Age is one. As someone increases in age, cardiovascular risk factor, cardiovascular disease can increase. Male sex, gender also affects that. Positive family history also affects that, and also genetic makeup of individuals. As you increase in age, your risk of a CAD increases. In men, the risk increases about after the age of 45. In women, it increases after the age of 55. The reason why you have a 45 for men and for 55 is really not known, but on a lighter note, perhaps it's because of a stress that men go through in life, in a pursuit of a career and pursuit of our family, can actually survive. And you can see women may not go through that. And that is the reason why men die faster than men. You have a lot of people who are, men that have died, and women, they are still alive, maybe because of a stress, but that is also on a lighter note. Family history or early heart disease is also there. Heart disease diagnosed before age 55 in father or brother. Heart disease diagnosed before age 65 in a mother or a sister. Modifiable risk factors are diet. You can modify it even if you are predisposed to have it as a result of diet, and that is exactly what we are talking about today. Mediterranean diet ordained by God is very, very useful. High potassium in fruits and banana necessary for high blood control. High salt diet predisposes to hypertension. We are asked not to take too much of a salt. Plant protein is preferred to animal protein, and also that can also help in what's it called now? In a kidney disorder. Now, low-fat diet, lean meat, better than fat meat. Red oil, palm oil is rich in vitamins and nutrients. And we always recommend when you take a red palm oil, do not bleach it or fry it too much. The good cholesterol inside is converted to bad cholesterol in the process of frying. Omega-3 fatty acid and fish is also good for cardiovascular state, especially oily fish is very important. And avoid the high-calorie drinks, high in sugar, phosphate, and low calcium. Also avoid the excess consumption of eggs. Now, how do we achieve good health for prostate and health? And let me now go through it now in detail. 80% of a premature heart disease in form of a stroke and prostate issues, and 40% of cancer could be prevented through lifestyle changes, healthy diet, regular physical activity, not maintaining sedentary lifestyle, avoidance of tobacco products, and exposure to environmental chemicals and compounds. Now, drugs happen to be like alternative that can be used in order to be able to cure diseases like hypertensive drug, chemotherapeutic drugs. But most of these drugs have a severe side effect. People that have a BPH or prostate cancer, there are drugs for them, but they have a severe side effect and can even cause a cardiovascular disorder and can also affect a sexual relationship with a partner. Therefore, there is then the search for alternative medicine on account of the toxicities of the drugs, the side effects of the drugs, and also the cost. People prefer alternative therapies with little or no toxicity, and these compounds or these agents are accessible, they are also available, and at the same time, they are effective. There are about 3 classes which I'm going to discuss very briefly tonight. You have a nutrition/diet, you have a plant-based phytochemicals, and you also have a dietary supplements. These 3 categories are applicable, compared to drugs. They are more or less natural with a little toxicity and can help people in maintenance of a healthy prostate and also in maintenance of a healthy heart. Now, dietary supplements have become prominent part of American population health culture, for instance. Today, dietary supplements comprise a major industry, and that is responsible for about $18.7 billion in sales. Herbal products use has increased about 380% in recent times. So you can see that the whole world is going through alternative medicine. Now, let me share with us briefly tonight some examples of nutritional therapies. This one is so common in Nigeria, in Africa, but very unfortunately, Malaysia took the seas in 1963, and Malaysia has become #1 producer of red palm oil. Red palm oil is so important to us and very, very useful to us, especially in Nigeria. Unfortunately, as I said before, because of a change in a Western diet, many families prefer not to use red palm oil, but they prefer to use some of oil that are common and that are peculiar to the Western world. And that is where we have encountered some of the problems we have in Nigeria. Red palm oil contains a lot of compounds, a lot of natural products. A typical example is this one that I've shown, which is a vitamin E analog. It is called tocotrienol. You also have quite a number of compounds in it that are very, very useful. Now, here are some success stories about the red palm oil. Recent advances have shown that it can prevent cancer. It is also relevant in cardiovascular diseases and also neurological disorders. So in the maintenance of heart health, and also protection against the brain, from damage. Tocotrienol and some other compounds in the red palm oil are proved to be very, very useful. Another thing that you can see as green leafy vegetables and fruits. Now, there is a very big study. We call it Siren study carried out in University of Ibadan, together with some other people in about 4 continents. And up to now, the researchers do not know, but some of us know. They found out that the people that they enrolled in the study, people that consume green leafy vegetables, especially dark green leafy vegetables, have a very, very low incidence of cardiovascular disorder, and they are not really susceptible to stroke. I, as a scientist, as a toxicologist and somebody who works in chemoprevention of cancer, I know this a lot, that the consumption of a dark green leafy vegetables play a crucial role in hypertension, in cardiovascular disorders, also in cancer. In actual fact, there is an inverse relationship between the development of a coronary artery diseases as well as a prostate cancer vis-a-vis the consumption of green vegetables. Tomato is another one, as I've shown here. Tomato contains a lycopene. Lycopene is a very, very important phytochemical in tomato. Whether cooked or uncooked, the lycopene is there. It is a very good agent in terms of a quenching of a signet oxygen and some other compounds that actually affect, generate reactive oxygen species and free radicals that bring about a prostate cancer and a prostate enlargement. So you also have these fruits that I've highlighted here. Now, I've shown this. This is one is common in our backyard, and that is a bitter leaf. We call it Vannonia amygdalina from the Asteraceae family. You can see some phytochemicals isolated from it. This is a gold mine. Many people do not know. Several compounds have been isolated from it that have actually been shown to prevent benign prostate hyperplasia and even prostate cancer. It is also very relevant in the modulation of a cardiovascular disorder. There is a friend of mine, a cardiologist in a UCH, who was attending to some patients many years ago. And they have given all sorts of drugs to this particular patient, yet the blood pressure could not be controlled, yet the risk factors are there and the person is almost dying. But all of a sudden, somebody told him to be taking the bitter leaf though in a moderate quantity and started taking it. After about 1 to 2 months of presenting himself in the hospital, the cardiologist, that is the consultant, had to ask him, what are you taking? Because the blood pressure was completely normalized and the lipid profile actually have been made to be normal. It is actually a gold mine. I've worked extensively on it as a scientist, as a pharmacologist, and I know it's very, very useful. Now, even this one that you see here, this is the jute leaves. That is ewedu. Cocorus oletorius is very, very important. Many people do not know. Either you cook it mildly or you take it just as it is raw. Is very, very useful and important. So at a time is going to come that someday doctors will not prescribe synthetic drugs, but they will recommend the cruciferous vegetables, green leafy vegetables, and they will be specially formulated in form of pills as foods, for a human being. Now, the other thing that is also useful that I've come about, that I worked about, is a soybean, very, very protective against benign prostate hyperplasia. Soybean genistein, I've done some work on it before, and it also able to protect against a nephrotoxicity, that is a damage in the kidney. The other one is what is a quercetin, which is isolated in most of these fruits, in apples, in what's it called, in onions especially. Quercetin is very, very abundant in onions and also in lime and also in the grapes. Very, very useful for these diseases. We've talked about the red palm oil. Red palm oil, you also have this a study that was carried out on account of the alpha carotene and some other compounds that they are very useful as an antioxidant and something that prevents against oxidative stress. This is very, very important. I've studied it extensively, and you can see bitter cola is so expensive now. I have been accused by several people that I'm the one that makes a bitter cola to be very expensive, because of a lot of studies that I've carried out on it, and on account of many secrets that have leaked out to so many people. Now, you have the peeled and the unpeeled Garcinia cola. You have a major phytochemical compound that is well investigated, by a number of us. At least this bitter cola, as a scientist, have investigated it in about 5 continents of the world. And I've collaborated with world-class researchers in United States, in South Korea, in Japan, in the United Kingdom, in Copenhagen, in Denmark, and in Germany, in South Africa, and also in Mauritius. I've done a lot of work on this, and we have found so many beneficial properties of this. One of the things that we found out is that the compounds in it have a way of preventing prostate enlargement. The study that we carry out shows that it decreases prostate weight when we induce hyperplasia. It reduces the generation of free radicals. It reduces inflammation. It reduces PSA. This is very, very unique and very important. PSA is an index of a BPH and a prostate cancer. And when we carry out these studies, we find significant reduction in the PSA. And that is very, very important. These are some of the things. Because of our time, I cannot go on to discuss some of the experimental studies that I have carried out. But as I said before, supplements are also very important. Some of these compounds have been isolated and put in form of pills as supplements that are also very useful, to us as a human. Now, I will spend the last few minutes to give examples of some of the forever living products that I have an encounter with personally, which I have used, and I know that they play important role. As I normally see time I give this lecture, I was introduced to the forever living products by this particular one that is called Immune Blend. Immune Blend, several years ago, about almost 14 or 15 years ago, personally, I used to have what is called a cold, or what is called virtually almost once in 2 weeks. But I stumbled at this and I discovered that within the space of 2 weeks of use, it vanished. And since that time, I've been taking it. And that made me to pay attention to some other products and some of the compounds and the components in some of these products, because I'm familiar with them and I know they're also present in some other agents. I'm able to actually identify, with some of these products and the importance and the role they play either in the maintenance of a healthy heart or in the maintenance of a healthy prostate and some other disease indications in the body. Now you have a Forever Active C, Immune Blend, Forever Lycium, you have a Garlic Thyme, you have a Vitalize, and etc. I will just go through briefly. You have a Aloe Vera Gel. It contains a lot of vitamins and contains a lot of anti-inflammatory agents. And in a benign prostate hyperplasia, inflammation is a very, very common. Oxidative stress is a very, very common. Also in a cardiovascular disease, you also have inflammation and oxidative stress. I refer to this as the two co-conspirators that are very, very present in many diseases. Now, aloe vera gel containing a lot of anti-inflammatory and antioxidative agents are able to prove useful in this. Now, you have the Active C. It promotes a memory, healthy brain, and cognitive function. And it contains omega-3 fatty acids, which is very useful to the heart. It contains a DHA and EPA, very, very important for the maintenance of a good heart. Now, Vitalize is something for people that experience benign prostate hyperplasia, enlarged prostate, frequent urination. This supports a healthy prostate and urinary flow. It contains pumpkin seeds that may help to keep normal PSA level steady. It contains saw palmetto. It contains quite a number of compounds that reduce dihydrotestosterone that is also implicated in a BPH and a prostate cancer. It also contains lycopene, as I said, that is present in tomato, and quercetin that I've mentioned before, that have very strong and potent antioxidant effects that can ward off free radicals and reactive oxygen species that are generated and been implicated in the etiology of a benign prostate hyperplasia as well as a prostate cancer. Ig plus is also another one. It contains vitamin B6, vitamin B12, and very, very important, forever calcium and a forever garlic thyme. It promotes a cardiovascular function. As I said, it also supports the immune health, and it is odorless. It is not unlike the garlic that many people take, and they don't like to take a raw garlic because of the smell. And this actually can produce a lot of a beneficiary effect. Forever C9 is also very, very useful for weight loss. As I said, obesity is an issue. When somebody is obese, then you are predisposed to cardiovascular disorder, and you can also develop enlarged prostate and a prostate cancer, as well as some other diseases that affect the body. So C9 promotes a weight loss and also is something that is recommended and can assist. Now, there are quite a number of clinical trials that have been carried out with some of the phytochemicals, and some of these phytochemicals are associated with some of the products that I've mentioned about. Allicin from a garlic, lycopene from tomatoes, docosahexaenoic acid from fish oil, and a saw palmetto for BPH. Now, look at this study, the clinical trial that was carried out with DHA and EPA present in a forever active C. It reduced the triglyceride level. It increased the high density lipoprotein, that is a good cholesterol. It reduces a low density lipoprotein, which is a very, very bad cholesterol. It regulates the blood pressure, and also very relevant in a hypertriglyceridemia, that is a high lipid profile in the system. Now, the clinical trial carried out with the lycopene, we can see in tomato, it reduces a PCA and a prostate cancer and a BPH in some of the patients, that took the lycopene in form of a clinical trial. Again, back to the structure of a benign prostate hyperplasia, you can see this. The drugs that are usually administered is a 5-alpha reductase, blocker alpha-1 blocker, and a phosphodiesterone inhibitors. Most of these drugs have a side effects, and the plant extracts have a little or no side effects and toxicity, and that is highly advocated. And some of the plant extracts have actually been isolated and inserted in the vital lines, which we'll talk about. Saw palmetto is one that is present in vital lines. And you can see the study that was carried out shows that it was very effective in the treatment and management of a BPH with little or no side effects against as compared with the therapeutic drugs. This is the clinical trial carried out with the saw palmetto, and the kind of a reduction that we have, percentage reduction in urinary frequency at night. That was very evident with the saw palmetto. And the increase in peak of urinary flow, it brought about a real flow of urine, in a female. So having said that, and let me just conclude. Now, undoubtedly, phytochemicals, on account of their intrinsic antioxidant and anti-inflammatory effects, they have the capacity to manage numerous diseases. Phytochemicals are supplements. At appropriate doses, they hold promise in managing ailments, and forever living supplements have been proved to be very effective. They may therefore qualify as new therapeutic signatures and multi-targeted agents for chemoprevention of prostate and cardiovascular diseases and other chronic diseases, which we can talk about later or at another occasion. I'll leave you with this, that time comes we can tailor nutraceuticals, for chemoprevention of chronic diseases, as I've mentioned, in recent past during this lecture. And I leave also this with you. It's my induction time ago as a foundation fellow of Academy of Medicine Specialties of Nigeria. Here he sits with the minister, of Health on that particular day of induction. I thank you very much for your audience. Thank you very much.
Wow, wow, wow. Please, can we give Prof a great big salute for this work? For this work they are done, the time taken, resources, and all they are put into this work. This kind of work are impactful to us in Nigeria and Africa in general. Thank you very much, Prof. God bless you for this. All the work you have done, they are so important to us. What you are looking for in Sokoto, you see it in Sokoto. Now we can begin to look inward. If all these Prof have enumerated, he has worked on them, personally worked on them, then we will have to take it serious. So, ladies and gentlemen, I want to leave you to ask your questions because Prof is ready to answer your questions. So it's question time. Question time. Any question? Question time. Oh, I'm indeed very, 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 very grateful for this. It's a big work done. Question time, please. Yeah, while you are typing your question, you can go to the chat house and paste your question there. Yeah. And see from what Prof have done, he has enumerated the risk of heart disease and prostate. They are very high among us today. So what do we do? Prevention is better than cure, as I said. So we have to look inward. Nutritional therapy is the answer. So we all have to. This has been proven and they have been worked on by our own Prof. That means we can use the products and recommend them same. In fact, our medical practitioners among us, doctors and pharmacists, nurses, and lab scientists, and all, we can join hands together to recommend these products because we need it. People are dying out of the risk of these problems. So question time, this is questions, let's take some questions. So this, with the science-based therapeutic nutrition, we can help to help our people with these food supplements now. So two questions. Prof, are you ready?
Yes, I'm ready. Somebody can coordinate the question session. Some questions are in the chat.
Yes.
Anyone wants to ask directly.
So when the prostate is enlarged, can these supplements and lifestyle change choice?
Yes, of course. Of course, that is what we have said. When it is enlarged, things can be done. It can go back to normal and can bring about amelioration and modulation. Because if it's enlarged and it's treated, then it can get back to a size that will not affect urinary flow and also some other functions.
Okay, thank you very much, Prof. It said, which of the Forever Living products is the best for treatment of prostate enlargements?
Well, from what I have known and what I've seen, Vitalize for men is highly recommended. A combination of Vitalize and Forever Multi-Marker, and Active C will also prove useful in the maintenance of a healthy prostate and healthy urinary flow.
All right. He said, thank you for your presentation, Prof. How true is it that when you stop having sex, there's high risk of having prostate cancer? Secondly, does using sex enhancement drugs have effect on prostate cancer or prostate glands?
Okay, thank you very much. Very important question. Now, some studies have shown that men that ejaculate about at least 21 times in a month are likely not to develop benign prostate hyperplasia and or prostate cancer. And some studies have supported that. And well, maybe the argument is that, regular flushing of the prostate and the prostate gland as a way of preventing prostatitis. You remember I talked about prostatitis, inflammation of the prostate, and that can be as a result of infection or bacterial accumulation. The function of the prostate is actually to introduce a gland, to introduce fluid that mixes with the spermatozoa, when there is a ejaculation. So if there is no frequent flushing of the prostate gland, one way or the other, it might lead to accumulation of a bacteria, and that can bring about inflammation and can also bring about enlargement. So it has been recommended. But at the same time, the use of a sex enhancement is not advisable. It may cause more problem or potentiate benign prostate hyperplasia, because the sex enhancement drugs that people use has a severe side effects, and these side effects can actually entrench the enlargement of a prostate.
Okay, amazingly. Say, good evening, Prof. You talk so beautifully in your presentation. You talked about bitter leaf. Is it in cooking as a soup or squeezing it out as water to drink for high blood pressure?
Well, I would say both in a way, but in everything, I would say something today about our cooking style, in Africa, especially in Nigeria. Green leafy vegetables are better consumed without cooking. But if you must cook, it must be with a reduced heat, because the phytochemicals and compounds therein, they get damaged and destroyed as a result of excessive heat. You don't overcook vegetables. Vegetables, you cut it just raw, and if you have to even cook maybe like 1 minute or so, and you take it down and you can eat it. But the bitter leaf can also be eaten, as I said, just some free, as some people, they can put it and squeeze it in water and take the infusion. Sometimes it's very cold. 1 or 2 leaves may be taken like that regularly, and that is also okay in the best situation. The ewedu that I talk about, some people can make it and just even take it raw like that. But if you must cook, it has to be with a reduced heat.
Okay, thank you, Prof. You said good presentation, Prof. Will these products be useful for people who are already down with the disease?
Hello?
Yes.
I can't hear you.
Oh, you said, will these products be useful for people who are already down with the disease?
Yes, they are also important and useful in terms of management. But better, before the onset or gets to chronic stage. You remember what we said, prevention is better than cure. But with some of these, you can also have a situation whereby there is management, because when the disease are setting, management is what is next, and that can also be relevant.
Okay, thank you very much. You spoke so well of benefit of palm oil. Please, where do we draw the line? Since it is high, it's also high in cholesterol.
Well, thank you very much. This is where many people don't really understand the beneficial properties of a red palm oil. Remember, I said that it's not good to bleach it or fry it too much, because the cholesterol that is there, when it is fried, it is converted to the bad cholesterol. And that is actually when it is very, very dangerous. But red palm oil in itself, in its original form, contains a lot of beneficial compounds. As I've told you about, you have what you call the carotenes and the carotenoids. Luckily, my first postdoctoral work was on a red palm oil, which I did in England in the University of Liverpool several decades ago. And we found out that red palm oil contains abundant amount of alpha carotene in particular, and some other carotenes and carotenoids, very, very useful in the system, in the body, to ward off free radicals and reactive oxygen species. But what happens is that when it is fried or it is bleached, then you have the bad cholesterol that one way or the other affects the system. But what is inside the red palm oil, the beneficial ones, outweighs whatever form of cholesterol or so, that is there.
Okay, thank you very much, Paul. So how do we regulate the steroids in plants taken dietally as opposed to extracted useful compounds in supplements?
Now, come again with that question. Steroids or what?
Say, how do we regulate the steroids in plants taken dietally as opposed to extracted useful compounds in supplements?
Well, that question, the person may not really understand properly what I said. You can't really talk about the steroids, in plants. Plants green plants contain a lot of phytochemicals and useful compounds, though they may be in form of extracts as compared to isolated compounds that you may see in a supplement. And again, some of the things you also see in supplements, they are crude extracts. But what happens is that you have like isolated single compounds, maybe in a supplement, but it's not just one. It may be a combination of 1 or 2 or 3 or 10, as compared to what you have in a raw plants that contains a crude extracts. But there is something we call a polypharmacy or polypharmacology. You have what you call synergistic interaction effects of so many compounds that are present in the plant substances, and they can synergize to produce a beneficial properties, compare even with just one isolated compound. A typical example is what you will see maybe in the vegetables you talk about. There are thousands of phytochemicals that are there, which actually are useful to the system as compared to what you might see in the supplements. Supplements have their role, and also plant substances, when they are also taken, also have their own role too.
All right, thank you very much. If one has been taking pharmaceutical drugs for years and the BP is controlled, can one maintain it with aloe vera products and ewedu?
Of course, sure. Of course, sure. If the blood pressure is normal and it's okay, those things are okay. There is no time for me to talk extensively about ewedu. There is no time, because it's a very, very, very powerful and very, very potent. And also what you will find in what's it called, bitter leaf and some other cruciferous vegetables. It's just that because people don't take this regularly. They don't take this regularly, and they are lazy, and they don't have the time to be taking this. That is why some of those things that are there have now been isolated and compounded in form of a supplement. So, but if you take the supplement, they are there. But at the same time, if you can also take some of these, our indigenous, plant substances, is also very, very superb.
Very good. Thank you, Prof. He said, thank you for the beautiful presentation, Prof. Is prostate cancer hereditary? If hereditary, how can it be managed?
Well, thank you very much. In the course of the lecture, I've talked about that. Of course, genetics or heredity also has a role to play. As I said, for instance, if your father or your uncle or people in your family have a prostate enlargement or prostate cancer, and you are a male, the chance that you are likely going to get it is also high, because you have come from your father. So genetically, you can have it because your father has it, your grandfather has it. That is a sacrosanct. But as you have said, if that is the case and you are aware of that early enough, you can begin to modify, that by changing your dietary lifestyle, issues and agents and food substances that can potentiate benign prostate hyperplasia or prostate cancer, you avoid, and you invest heavily in substances and agents that can ameliorate or attenuate, the development of a BPH of prostate cancer.
Oh, very good. Thank you, Prof. He said, not long ago, I tried to talk to a friend about herbs, even bitter kola, but she insisted that she will not take it, claiming that bitter kola and bitter herbs damage the liver. How true is this?
Absolutely incorrect. Absolutely incorrect. It's because many people do not know. Bitter kola is the blessing of a God to humanity, especially the secrets that we have here. I've worked on bitter kola for over 30 years. As I said, for over 30 years, I've worked on bitter kola. And by the grace of God, I've produced not less than 15 to 17 PhDs, on bitter kola, and several master's students on bitter kola. In fact, some of those PhDs, they are professors today. And we've been working on it for over 30 years, and we are still working on it even presently. And as I said, it's not only what that I've done in Nigeria alone. I've worked, with bitter kola with the whites in Seoul National University in South Korea when I was a visiting professor there. I worked with collaborators in Chicago School in the United States, in Japan, in the University of Jena in Germany, in Copenhagen. I've worked with them. So we know so much about the bitter kola. And in actual fact, the major thing that bitter kola does is that it cures liver diseases, hepatitis particularly. Hepatitis, liver disorder. Bitter kola primarily, does not allow hepatitis or liver disorders to actually, occur. It's the major role that the bitter kola, does in the body, apart from some other, chemical compounds. It's not the time to talk about it because we are not really talking about that, but just briefly, these are some of the things that we know about it, and your intake of it moderately is very, very useful and very, very important. And even for some other indication. Bitter kola, let me just give you this, you may take it. Bitter kola is also an aphrodisiac, you may know, natural aphrodisiac. Men who take a bitter kola regularly, about 2 or 3, they are very, very powerful in bed. Very, very powerful. It enhances their sexual prowess. This has been confirmed again and again, again and again.
Oh my God. I wish you have time to take all these questions because questions are flowing in endlessly. But let's just take this one. Let's say this one. Say, how can one create awareness, since this disease claims so many lives, especially for here in Nigeria?
Well, thank you. Here is one of the avenues to create awareness by this lecture. I can see almost about 200 people or whatever have participated in this webinar today, which is quite a large. It's part of the advocacy, and some have given several lectures, and some government people have been a part of it. I have chaired a session on the Gasina Cola Summit, organized by Ministry of Environment and the Ministry of Health about 10 years ago, and the communique came out of it. And also conferences, also through news media, then we have been able to do this. As I said, many people say that I make some of these agents to be expensive because during COVID-19, I was on the television and the radio virtually almost every day, talking about that, and quite a number of people benefited from the use of natural products to actually cure and manage COVID-19, in the year 2020. So here, the one that is being organized today by this organizer is also an avenue, to publicize it and to say one or two things about it, and everybody can also learn one or two things.
Yeah, every Wednesday we have this awareness program on Zoom so that we can create more awareness for people, because many people are not aware. So we do create awareness every Wednesday evening by 8 p.m. You can see the person who invited you here today to give you more information. Let me just take this, Prof, as the last question or comment. Really appreciated, Prof, for the insightful presentation, quite detailed. Do you mind a bit of contribution, sir?
Yes.
Yes, I am a dietitian and really interested in the presentation. It was quite educative, I must say, and I must say it was really, it's just a comment. Thank you very much. Thank you very much.
Thank you for the compliment.
All right. And this should be the last. We'll take this as the last one now, Prof. But we have spent so much time. Say thanks, Prof. You said the herbal drugs are more available and cheap. I know forever living products are very effective, but my problem is that they are not cheap to get, despite being herbal. Secondly, on sex enhancement drugs, we have many herbal products that help to be sexually active to help reduce prostate cancer. What do you advise in this?
Well, the first part of the question, I think, is you organizer forever that will be able to answer that. They say it's available, but it's expensive. Well, that is a question for you to be able to let them know why it's expensive, maybe on account of economy or foreign exchange and dollar to naira exchange. But the other question, can easily be answered. That is the use of natural products, maybe in terms of enhancement as compared to synthetic drugs. I think that is okay because it's purely natural. And because it's a natural, it's not likely to produce any side effect. Natural agents that can increase moderately nitric oxide in the body, that can also increase what's it called now? Testosterone. Maybe it's very low in men and can enhance libido and can also bring about healthy, sexual activity in men. There are quite a number of them that are quite natural and available compared with sex enhancement like a Viagra, which is a phosphodiesterase inhibitor, Viagra or Cialis, very, 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 very effective, but has a severe side effect. And one of the severe side effects is that it can have negative effect on the heart. And that is why when some people, they use this, you can find that they can collapse or die on top of a woman, as some people have gone to the early grave on account of indulgence in this sexual enhancement without a control. But the natural products, are very, very potent and with a little on side effects.
Thank you very much, Prof. And like Prof said, actually, forever living products, they may appear to be expensive, but if you look at it, they deliver. The contents are good. They are natural products, and you get benefit for it. I remember
Absolutely.
when I joined the business about 22 years ago, we bought a pack for about 38,000 naira, which has come to 4 or something because of exchange rates. Yet the company is subsidized greatly, greatly. So the company will not exist to die, but you know that what they are giving to you is real good products. So you bear with us until the economy can be managed back to normal. We can't do without taking the products. Prof, we want to thank you immensely. We want to thank you greatly. We want to thank you for this goodness of yours. But one thing I want to request for, because of popular demand, people are asking, they're asking for the slide. This slide, can we have it? Look, I'm not tired of the questions here. Can you have the slide? Can we have the slide? So is it possible for us to have it through Dr. Idigo? Can we have it
No problem.
and share with you? Oh, thank you very much. So you have heard it, and the Prof has agreed to give us the slide. We have it. Go back to the person who invited you to have the slide. Thank you. Yes, the recorded version of the presentation will also be out from tomorrow. Please make sure please don't just listen and go, but listen and do the needful. It's your health that we're talking about here. Your health is important. So reach out to those who invited you, who will give you more information for this. So we're going to share more information, and we keep on creating awareness. Every Wednesday, this program runs on different topics on health. Prof, thank you very much. God bless you and your family. Thank you very much.
Thank you very much. My pleasure.
Yes. Also, we have to thank you too for coming, all invited guests. And when next we invite you, please do attend. God bless you for coming. God bless you. Come with your family. You benefit from these talks. They are free talks. Thank you very much. God bless you. So good night, everybody, for your time spent today. It's a worthwhile time. It's a worthwhile time. And we appreciate that in spite of Nigeria network problems, but we're able to go through it. Thank you very much. God bless you all for coming. Good night. Good night. Have a nice rest. Good night.